Okay, thank you very much. Hi, everyone. I'm just going to get going with some of the latest statistics, the Ontario statistics. Well, for 3 days in a row, we've been less than 1,000. Today was 870 increase, a bit more than yesterday, but it's certainly in the 1,000 range now, which is a good sign. Again, Toronto area increase is the major contributor. We're starting to see a slow decrease in hospitalizations and ICU admissions across the province as well. Ottawa had 43, and we continue to have a real good decrease in our cases over the. Just trying to get my screen here. Wrong one. There we go. Jenna, you can see the local statistics. Just want to make sure. Yeah.
Yes, we can. Thank you.
Okay, thank you. So we're up to 105 total cases. We've got 5 hospitalized, 3 still in the ICU. Unfortunately, we've had 2 deaths over the last week or so. They were in elderly individuals from the community, not in congregate care settings. And it's tragic. We have one outbreak at this point. I just wanted to, actually, it's not on a congregate living setting at this point. It's not a COVID one. And if we're looking at our numbers, we're over 113,000 vaccines, and I'll talk about that later. But I wanted this to really show you and go over our rolling average, which again is really going in the right direction. You can see here that we're really down to 14 actually as a number, so we're still yellow. We've taken the colors out here because the next iteration of the framework will not have colors in it. It will just be step 1, step 2, step 3, but it'll still be guided on 7-day rolling averages and so on. But then you can see clearly we're on the way down in terms of our changes. We've seen again, we just added actually 2 cases, but it works out as 1 because there was a data collection yesterday, and in that situation we then saw the number just go up by 1. So you can see clearly we're on the right direction when it comes to that. And so some of the things that we're looking at right now really have to do with the maintenance of our public health measures. Of course, what we're dealing with is now the stay-at-home order has been lifted. However, we're still in that pre-step 1 phase. We're trying to make sure that the numbers go down enough, and obviously the vaccine numbers up in the right direction in order to allow for step 1 to come in by the 14th of June. Again, I'm not sure. The Premier said yesterday, likely maybe a couple of days before, depending on the numbers and how they behave downwards. Obviously, we're paying attention to the variants of concern, particularly the one from India. Now it's called Delta. We want to keep a close eye on that one and ensure that we still take the public health measures very seriously. As you know, yesterday, the government also decided that the schools would remain closed. And that was a bit of a disappointment to us because we thought that they should open. Multiple benefits. It wasn't just us. It was pediatricians, pediatric hospitals, and so on. In any case, we're just now going to be working with school boards to ensure that school reentry is goes smoothly, and we're now going to be again focusing on our vaccinations and moving forward in terms of our numbers. And so you know, we're today we saw over there we were over 100 and I think 110,000. I've got it here. We're 113,000. Actually, if we add 2 that we've done today, we're another 2,000. So we're about almost at 115,000. That represents close to 69% of the adults, and so that's great, and that's on par with the rest of the province, where we're continuing to push the vaccines. A few things that are of to note. Again, we're now reaching reaching out to individuals who are due for their second dose. They're getting an email and they're going to get a call from us. And so there will be mechanisms for them to have their second dose. The other thing is that we have special clinics, although to date we have over 4,000 students who have booked appointments, and most of them before June 14th. But we also have, I just want to say that we're encouraging parents and guardians to select an appointment at a specific youth vaccination clinic in the system, because at that point they will automatically be given a second dose appointment before August, before the end of August. So we want to ensure that they get it. Now, if no appointments are found, that you could book at any mass vaccination clinic, and we'll ensure that the second dose is given before school begins. Now, speaking of second doses, we are going to be shortening the interval progressively. I just got off a call, 80 plus, 70 plus very shortly, and then moving quickly. There is a bit of a rush to get the second doses out. As you can see, we've reached 70%. By the end of the week, we'll be closer to 75%. You kind of be plateauing. So moving forward, we're going to be concentrating on second doses. We've now booked clinics for over, oh my God, 120, 130,000 second doses already between now and the end, the second or third week of August. So those are being planned, although in the system we've only put until the first week of July, because we have to do it a month at a time. So there will be, we're preparing for that. We do anticipate, and we are encouraged both by the ability for us to essentially pump up the volume, if you like, increase the volume of our vaccine delivery at each one of our clinics, and again, we're expecting more vaccine over the July-August months. So we're quite confident that we'll be able to reach that second dose level of 75, 80% as well. And obviously, in terms of the step 1, step 2, step 3, already we're available. Our vaccine numbers are already at step 1, which is 60%, and then we're going to be looking at step 2. Being 70%, which we're almost there right now, and then second doses being increased again accordingly. And again, our goal is to, for a multitude of reasons, really is to ensure that we vaccinate as many people as possible. A second dose between now and the end of August. That's going to do two things. Number one, it's going to ensure that we have fended off, any threat of the variant, the Delta variant, because the Delta variant, for optimal protection, needs 2 doses. And secondly, it's a key to reopening. It's a key to, reopening even more, removing masks and mask mandates and so on. But in the interim, again, I want to stress that we're not there yet. There's going to be guidelines for people that are vaccinated. There's going to be guidelines for when a certain percentage of the population is vaccinated, when masks can be removed in the interior and so on. So it's quite important that between now and then we continue status quo, regardless of your vaccination status, masking, physical distancing, and so on, and respecting the gathering limits, which are now 5 and are going to be 10 in the future. And then as we go into the summer, they'll start going indoors as well. As we go into the summer, again, the numbers of the second doses will increase as well. I had a question, and one of the questions that I had is, what is a percentage of population that we've now vaccinated? It's really very small. It's probably around 3 to 4% in our health unit, and I know provincially they're at about 6%, and that because it's skewed by the hotspots that have gotten 2 doses already, and so we're going to rev that up quite quickly. And so as we're starting to book those second doses, and like I said, there will be accelerated second dose intervals, and we do have the capacity to do that. And again, that's all good news in that regard. Bonjour tout le monde. Je vais commencer avec les chiffres antériennes. On a eu des bonnes nouvelles encore. Troisième jour de fil, qu'on ait moins de 1000 cas par jour. En effet, aujourd'hui, on a 870 cas. Hier, on était 700 quelque chose. Donc, ces 3 jours de fil, espérons que ça va continuer en diminuant. C'est toujours Toronto qui mène au niveau des cas. On voit que Ottawa avec 43. Nous, dans notre région, ça va bien au niveau des cas quotidiennes qu'on ajoute vraiment. Actuellement, on est rendu. Attendez, je vais juste le mettre en français ici. On est rendu à peine 100 cas actifs dans notre région, 105, et nous avons 5 patientes hospitalisées, dont 3 sont dans soins intensifs. On a ajouté 2 décès des personnes âgées, malheureusement, qui étaient dans la communauté, qui n'étaient pas dans des centres de longue durée ou les maisons de retraite. Et nous n'avons pas de flambée au COVID, ça c'est pas une flambée de COVID à mon connaissance. Et on voit ici qu'on a vacciné plus que 113 000. En effet, aujourd'hui, on va être à 115 000. Je vais parler tantôt de ça. Mais on peut voir ici que aujourd'hui, nous avons ajouté à peine 2 cas. Mais on a changé, on a diminué un cas de SDNG hier, c'est à cause des chiffres du gouvernement qui ont changé. En effet, on a ajouté 2 cas de plus, une à Cornwall et vraiment une à Prescott Russell, mais c'est minime si on compare que ce qu'on avait il y a quelques semaines. Et si on voit au niveau des moyennes mobiles, on peut voir facilement que vraiment on est sur la très bonne direction. Vous voyez ici, on a éliminé les couleurs, les zones de couleurs, parce que le nouveau approche de réouvrir l'économie, etc., va dépendre au niveau de étape 1, étape 2, étape 3, pas des couleurs. Par contre, ça va toujours compter sur les indicateurs comme les moyennes mobiles de 7 jours qu'on voit ici. Donc, ça, on va dans la très bonne direction vis-à-vis nos cas. On voit ça aussi en Ontario. Aussi, à travers l'Ontario, on voit que les admissions aux soins intensifs, doucement, sont en diminuant. Même les hospitalisations aussi commencent à diminuer de façon importante à travers l'Ontario. Et comme vous savez, aujourd'hui, c'est le premier jour qu'on on a enlevé l'ordonnance de rester chez vous. Par contre, toutes les autres mesures restent en place. 5 personnes maximum qui pourront se ressembler à l'extérieur et les parcs de tennis, etc., restent ouverts. Il n'y a rien qui change. D'ici la semaine du 14 juin, tout stable va rester. On ne sait pas quand exactement, mais on va rentrer dans l'étape 1 à peu près la semaine de 14, quelques jours avant, on n'est pas sûr encore dépendant les chiffres antérieurs et moyennes, etc. Nous allons voir aussi à ce moment-là que, en effet, on a déjà l'indicateur de vaccination, 60%. On est rendu à presque 69% dans notre région. Donc, ça, c'est une bonne chose. Par contre, on va voir, donc, quand on rentre dans la première étape, ça va être doucement, ça va être plutôt les activités à l'extérieur, avec l'exception des magasins en détail qui vont ouvrir, mais avec un minimum de capacité, 15%. Donc, les restaurants, les patios, on pourrait aller manger à l'extérieur seulement. À ce moment-là, on va attendre 3 semaines et puis on va aller au TAP 2 qui va avoir beaucoup plus de champs, beaucoup d'autres choses qui vont ouvrir et les étapes 3, etc. Et avec ça, ça va coïncider avec une augmentation des doses, surtout les deuxièmes doses de vaccins, qui va faciliter, à mon avis, les mises en, qu'on va enlève vraiment les restrictions qu'on a actuellement de façon progressive. Donc, ça tombe au niveau des vaccins. Donc, au niveau des vaccins, on est rendu maintenant, si on compte les vaccins qu'on va donner aujourd'hui, à peu près 2000, on est rendu à 115 000, donc qui nous représente à peu près 69% des adultes éligibles dans notre région. Ça, c'est très bon chiffre. Ça, c'est à peu près la même qu'on voit à travers l'Ontario. Et aussi, on nous rajoute des cliniques dans toute la région. Nous avons déjà planifié des cliniques d'ici la deuxième, troisième semaine d'août avec plus que 120 000 ou 130 000 places au moins à ce moment-là. Et nous avons ajouté cette fois-ci des cliniques jusqu'au 5 juillet pour les personnes qui pourront faire le rendez-vous. Je vais parler des deuxièmes doses tantôt. Mais je vais juste vous dire qu'on encourage les enfants de 12 à 17 ans. On a des cliniques spéciaux, soit la semaine du 14 juin et la semaine après, sont dédiés, sont pas tous les cliniques, peut-être 75%, une portion est dédiée aux enfants et leurs parents. Et à ce moment-là, on encourage les parents de prendre rendez-vous avec dans ces cliniques, parce qu'avec ces cliniques, vous allez recevoir automatiquement votre deuxième rendez-vous avant le 20 août. Si, par contre, vous ne pouvez pas faire rendez-vous, prenez votre rendez-vous quand même. On va l'arranger que votre enfant va recevoir son deuxième vaccin avant l'entrée d'école, donc soit avant le 20 août. À ce moment-là, on va avoir ça. Donc, déjà, nous avons 4000 quelques qui sont déjà bookés dans les cliniques, donc 800 seulement dans les semaines de 14 et 21 juin, mais quand même, on va procéder d'une façon satisfaisante, à mon avis. Aussi, en parlant du deuxième dose, c'est très important que là, comme vous voyez, on va être rendu à 75% très bientôt dans puis ça va être comme un plateau, si vous voulez. Donc, la plupart des vaccins qu'on va recevoir dorénavant, d'ici la première ou deuxième semaine, la semaine prochaine, par exemple, ça va être dédié plutôt aux deuxièmes doses. Et on va commencer, déjà, on commence avec les personnes de 80 ans et plus qui pourront avancer le rendez-vous, soit en appelant le numéro provincial ou sur le site web. Bien sûr, bientôt, ça va aller des 70 et après ça, ça va aller avec les âges diminuants qui pourront qui pourront avancer leur deuxième dose parce qu'on a hâte vraiment de commencer à donner le deuxième dose parce que les variantes, celle-là de Delta qu'on appelle, euh, le maximum au niveau de protection, c'est on a besoin de 2 doses. Donc, pour cette raison aussi, et aussi pour le plus vite qu'on pourrait donner le deuxième dose, le plus vite qu'on pourrait avoir le clé de sortir des pas mal de restrictions. Donc, on a des bonnes raisons pour qu'on puisse vraiment accélérer le plus possible les vaccins de deuxième dose. Nous aurons vraiment décliné les livraisons des vaccins qui va augmenter à mois de juillet, à mois d'août et mi-juin aussi. Donc, le débit avec lequel on va recevoir le vaccin va être augmenté et notre capacité est là. On pourrait l'augmenter au fur et à mesure au besoin si on reçoit plus de vaccins. Donc, on prévoit qu'à un moment donné, d'ici le fin août, on va avoir donné le deuxième dose à la majorité des personnes dans notre région, en effet plus que 75 à 80%. Et à ce moment-là, ça va avoir réussi 2 choses. Une, qu'on va être capable de protéger non seulement contre le COVID ordinaire, mais le COVID D qu'on appelle Delta. Et aussi, ça va nous permettre vraiment de commencer à accélérer la vitesse avec laquelle on va enlever les restrictions. On va il va y avoir des changements au niveau des masques, les besoins des masques, les besoins de distance physique, etc. Mais tout ça reste la même parce qu'on n'est pas là encore. Donc, d'ici là, il fallait toujours respecter de porter des masques, les précautions de santé publique, etc., jusqu'à nouvel ordre, parce que on voudrait être parce qu'on sait que le variant pourrait retourner ou pourrait augmenter dans notre région et qu'on veut vraiment que ça soit une bonne sortie. On va sortir pour la dernière fois d'un lockdown. Donc, je pense qu'on a des bonnes, ça c'est toutes des bonnes nouvelles et je demande à tout le monde d'avoir un peu plus de patience et vous allez voir, le plus qu'on approche le mois d'août, septembre, le plus que vous allez voir une tendance de normalité, si vous voulez, ou un retour à la normale. Pas à tout à fait normal, mais beaucoup plus normal qu'on avait avant, surtout à l'entrée d'école, surtout en automne et en hiver aussi. Mais aussi, ça prend encore un peu plus de patience. Quand on va rouvrir, de faire attention et d'aller se faire vacciner pour qu'on puisse avoir vacciné le plus les gens possible. Parce que le plus haut le pourcentage qu'on protège dans la population, le plus facile, le plus difficile, ça va être pour le virus de retourner. Donc, ça, c'est des très bonnes nouvelles que nous avons actuellement et nous allons continuer avec nos capacités de vraiment donner les vaccins. Et aussi, n'oubliez pas que ce n'est pas juste nous qui donnent le vaccin aussi. On a les pharmacies qui vont nous aider. On a les médecins, les bureaux privés, les centres familiales, les centres communautaires de santé qui aussi vont contribuer au vaccin. Donc, à ce moment-là, je pense que le but d'avoir vacciné le maximum de notre communauté avec 2 doses d'ici fin août, je pense que c'est très, très, très réaliste. Je peux vous dire que c'est très réaliste et c'est de bonnes nouvelles. So I'm just going to answer some questions here. The first one is of the 110,000 shots given, how many people are fully vaccinated? At this point, we're in the 3,000 to 4,000 range, Bill. This is something that we're working on, obviously, and this is mostly the individuals that we gave 2 doses to in the long-term care and retirement homes. La question a été, parmi les doses qu'on a données, c'est quoi le pourcentage de personnes qui ont reçu les vaccins, la deuxième dose? Je peux vous dire que c'est 3 500, pas plus que ça, mais ça va augmenter bientôt. Mais ça représente plutôt les résidents des centres de longue durée ou des maisons de retraite. Are we anywhere near to close to 20%? No, we're not there at this point. 20% of second dose is not now. It's step 2, step 3, if I'm not mistaken. Right now, the first step, Bill, is really in 60% of first dose. There's no second dose requirement for step 1, but there is progressively, and I think we can very rapidly reach those. We're talking 5, 10, 20%. It's somewhere in that domain. I want to be 75, 80% by the end of August. That's really what I'd like to be at. Is there an update on policies that allow people with 2 doses or more freedom? Are there any coming soon? Yes, we're actually working on those. We're working on those progressively, Jordan. There's a plan of, okay, what can you do if you're all vaccinated 2 doses in terms of masking, physical distancing, depending where you are, and then those become even looser restrictions as we go into step 1, step 2, step 3. So those documents are being worked on right now, and hopefully they'll be coming out quite soon, so people can get a glimpse of what it'll be like when you get your 2 doses and so on. So that's I think it's very important. How many cases have been linked to outdoor activities? I can tell you that the majority of our cases are indoor. The only one I could remember is 1 or 2 out of all the outbreaks that we've had. And I do know that according to the science table, you are 20 times more likely to have an outbreak from an indoor setting as compared to an outdoor setting. And that's why we're promoting outdoor activities first as part of the reopening. How many studies have been conducted on the efficacy of vaccines on different variants, and what are the results? There have been several studies that have looked at these current vaccines, and with the exception of the Indian variant, which is the Delta variant, the vaccines that we have in play right now give good protection to all the 3 other variants, the UK, the South African, and the Brazilian one. I think there's 3 of them. The only one that we have a bit of a more what we call immune evasiveness. In other words, immune escape that the vaccine doesn't fully cover with one dose. Is the Delta one, the India one, and that one, the first dose protects you about 30-40%, and the second dose will bring you up to the higher levels. So that's why we're very eager to get out the second doses as quickly as possible. Now that we know that we're going to be getting them more. One of the restrictions, as you know, initially was that the doses were trickling in. Now that they will be coming in at a higher rate, we'll be able to accelerate those second doses specifically for those reasons as well, and also for wanting to progress with the removal of restrictions as quickly as we can as well. Jenna, that's it for these questions. Please open it up to the media.
Thank you, Dr. Paul. Merci. Our first question comes from Eric O'Brien, City News. Please go ahead.
Hey, Dr. Paul.
Hi, Eric.
My question is actually about vaccine allocation, I guess. How stable are the vaccine supplies coming into the Eastern Ontario Health Unit?
They're extremely stable. We are given a 4-week sort of predictive allocation, and then they confirm it like week by week. And so far, over the last 4 weeks, they've been right on.
Oh, that's good to hear.
Yeah.
Yeah, just because I was asking questions a little bit around the Valley today, and it was kind of fluctuating in other places. So I guess that means that's why you can book all the way up until August the vaccines.
Well, right now, what we've done, we're planning our clinics up until August, and we know how many that we can give based on what we're receiving now. The ones, however, that we put to make available till July, like right now we've added till July 5th, we actually know those are the numbers that we've been given as they're not confirmed yet, but they're estimates. So we're basing it on those because as we get closer, so we know that, the 2-3 week prediction is right most of the time. So it gives us a bit of a leeway. We have not made our August clinics available yet. They're just on paper. But as we know and get more closer to those dates, and we know that, yeah, you'll be getting those vaccines. And if we're getting more, we'll just add. That's how it works.
Okay. So that means it could change very well, like a couple weeks before. You just have to confirm with I guess your patients, right?
That's right. What we do is we always err on the side of safety. Obviously, we know, like we will never book 2 months in advance because we can't predict it. In the past, by doing that, we get caught because we would get our allocation cut. But now, in most scenarios, what will happen is our allocation will increase, not decrease. So, which is good. We'll deal with that.
Right. Sorry, everyone. Just one last question, just kind of on the same train of thought here.
Yeah.
Because I guess it's more of a yes or no question, because the allocations that you're getting, you're taking into account that people will start becoming eligible for a second dose.
Yes.
And continue being eligible for a first dose, right?
Yes. The thing is, once we've reached an allocation of 70, like we're going to be probably 75-80% of first doses, we're going to be continuing getting doses as if we, the number of doses. So what will happen is, in a clinic, eventually we'll have, 20% first doses, but 80% of our allocation will go to second doses. So when we calculate that, because we know how many are first doses, how many are second doses, how many are residual, we're very confident that we'll be getting enough to vaccinate, what we need between now and the end of August. That's how we're coming up with those numbers.
Thank you.
No problem.
Next question, Natasha Wood, Nation Valley News. Please go ahead. Perhaps we can go to the next and come back.
Okay.
Nelson Zandbergen, Nation Valley News, also asks, what drugs will a doctor prescribe or recommend to a person diagnosed with COVID-19 who is staying at home? They make prescriptions for people with flu and cold. Do doctors offer any prescriptions for those convalescing at home?
this point, there is no specific antiviral medication. And for most viral infections, what we give a drug or a prescription, we give it as what we call symptomatic treatment. So let's say somebody has a fever or pains, we give them a pain relief and so on. There's no, with the exception of influenza, where we have a specific antiviral medication that's given if you catch it early on. There really is no specific antiviral treatment that we give somebody with COVID. It'll be more something that will be around what we call symptomatic relief.
Also, Stats Canada came out with data June 1st showing the average life expectancy in Ontario in 2019 was 83. The average age of death for COVID patients was 82.44. Does this put the pandemic into a little bit of context for Ontarians?
I don't think it does any context. I don't think the two are related. I think that we know that the life expectancy in males and females, we know that. I don't think that what it tells us is that the majority of people that died from COVID were elderly, which is what we knew. And we knew that they were the more frail and vulnerable populations. And that's why we actually started to vaccinate them first.
And are yard sales allowed?
At this point, they're technically not allowed because you can't have more than 5 people unless you can control the 5 people, but technically they're not allowed unless you have to limit to 5 people. And again, we recommend that people wait a bit longer if they want to get more people, because otherwise they're going to have to limit it. Technically, you can have on your property 5 people max, but that includes you as well.
Thank you. Natasha Wood, Nation Valley News. Please go ahead.
Hi, Dr. Paul.
Hi, Natasha.
My microphone just had a bit of a wobbly there. So is COVID-19, is this going to be a thing that's going to continue for years and we're going to have to get vaccinated every year?
Good question. We although we don't know, a lot of us are speculating that it's here for a while, and we're going to have to keep an eye on it. We think it's going to be seasonal. And so we can't rule out the fact that we may need boosters or certain boosters and those type of things on a yearly basis. Again, it's too early to tell, but experts are saying that this won't fizzle out that quickly. It may remain as something that comes cyclical. And so, yeah, the chances are that will happen. But again, this is speculation. Only time will tell.
Okay, thank you so much.
You're welcome.
Julia Lucio, the Seeker, asks, the step 1, 2, and 3, is that going to be on a regional approach or provincial approach?
We had recommended a regional approach because we thought that certain areas would ahead of others, but big regions, but it seems that it's going to be provincial.
Next question, Bill Kingston, Cornwall Newswatch. Please go ahead.
Yes, hi, Dr. Paul.
Hey, Bill.
Looking for some clarification. So you talked about 3,000 to 4,000 range of people that have got second doses. You said 3 to 4% of the population.
It's less than that. It's actually less than that. It's actually probably, it's 3,000 and it's actually 2%.
Okay.
If you look at it, because I'm putting it over 167,000.
So if the target is 20% of the province by step 2 of the roadmap to reopen, which would be in the middle of July, if everything goes according to plan, and you have 130,000 second doses by the 3rd week of August, even if you're half of that, can you safely assume you're going to easily hit all the targets for the roadmap?
Yeah, I'm pretty sure because they're very low. Like we're trying to get 75 to 80% in August. And so if you look at the numbers and, where we are now, and if we start switching our vaccine priorities, to the second dose, with the numbers that we're getting, we will reach the 20 very quickly. As a matter of fact, the province now is just revving up. They're at 6.9%. They're a bit ahead because the hotspots got it earlier, but we can rev it up as well. We can bring it up quite quickly. So I'm confident that we'll be reaching that level. But don't forget, it's first dose and second dose for those steps. But it's not only the vaccine levels. It's also indicators like case numbers, R naught, and so on.
Mm-hmm. Speaking of which, just out of curiosity, what is the R naught? It must be well below 1 now.
Oh yeah, we were at point. Hold on, I had it yesterday. Hold on, no. I don't have. I had it yesterday. The R naught in the province is 0.76. I'm trying to. I had ours as well. We were 0.44 a couple of days ago.
Okay.
Yeah, with a percent positivity of 1.8%.
1.8%. Okay.
Yeah.
Thank you very much.
Okay, no problem.
Do those joining by phone have questions? Press *6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you, merci.